alveoli. So when we take our deep breath out, that's how the carbon dioxide is removed. So it's the alveoli of the lungs that serve that purpose.
And again, what does the heart do in the body?
What does the heart do? Well, the heart is the major pump, of course, of the body. The best way to think of the heart, in my view, is to actually think of it as two pumps, sort of a right side and a left side. So if we start with the right side of the heart, after all that blood got pumped to the body and is coming back to the heart, blood is always returned to the right side of the heart. So this is now blood that presumably does not have much oxygen in it, and it needs to get more oxygen. So that right side of the heart, its job is singular. It is to pump blood to the lungs, to those alveoli. So the blood, when it heads towards the lungs, it can pick up that oxygen that it doesn't have right now, and it can deliver carbon dioxide and other acids and waste products to be expelled from the body. Once that blood from the right side of the heart has picked up the oxygen that it needed, it sends it to the left side of the heart. Now the left side of the heart gets all the glory because it is what then pumps all of that oxygen and nutrient-rich blood to the entire body, meaning to the lungs, to the kidneys, to the brain, to our muscles, to deliver oxygen, because every organ, every tissue of the body needs oxygen in order to function. And then once that process occurs, it repeats back to the right side and so forth.
And what happens if the lungs can't deliver sufficient oxygen to the heart? That is, if there's a low oxygen situation.
Okay, well, the heart is only as good as the fuel that it's provided with. So when that right side of the heart sends blood to the lungs and says, okay, can I have some oxygen, please? If there is no oxygen there, or not enough oxygen there, there is nothing the heart can do to extract more from the lungs. So it has to take that deoxygenated blood that does not have enough oxygen, and pump it to the left side of the body. The left side of the body says, okay, this is what I have, this is what I'm going to pump now. And so what ends up happening is if the lungs don't give enough oxygen to the body, the heart then has to pump insufficiently oxygenated blood to the tissues of the body, and that's when problems occur.
Well, then returning to your opinion, cardiopulmonary arrest caused by low oxygen, induced by positional asphyxia. What caused the low level of oxygen in the case of Mr. George Floyd?
Well, in his case, it was truly the prone restraint and positional restraints that led to his asphyxiation. In a nutshell, he was just simply unable, using all of his muscles of respiration, his chest wall, what we call accessory muscles of respiration, which are extra muscles that will be triggered in the event that you're having trouble breathing. He was trying to get in enough oxygen, and because he was unable to, because of the position that he was subjected to, as we just discussed, the heart thus didn't have enough oxygen either, which then means the entire body is deprived of oxygen.
So, low oxygen induced by positional asphyxia. Did you consider other possible causes for Mr. Floyd's death?
Sure. I tried, of course, to be as thorough as possible, but I focused mostly on two other potential causes. Number one is whether there could have been a primary heart contribution to George Floyd's death, and the second was whether a drug overdose could have caused his death.
So, doctor, would you tell the jury what is a primary heart event?
Sure. So a lot of things can injure the heart. For example, if you do not take in enough oxygen, that will injure all the organs, including the heart. When I use the term a primary heart event, I mean something that originated from the heart itself. So for example, a heart attack. All right, one of the arteries of the heart just suddenly got blocked completely and a heart attack occurred. Or the heart just, without any explanation, nothing else secondary inducing it, went into a serious ventricular arrhythmia. Okay, so the bottom part of the heart, that part that we were talking about that needs to pump blood to the body, suddenly went into a chaotic rhythm all on its own. If any of those things happened, then I would consider that a primary heart issue, not being caused or secondary to something else.
So you considered whether or not Mr. Floyd might have passed away from a primary heart event or a drug overdose. Did you reach an opinion or conclusion to a reasonable degree of medical certainty as to whether either of those two causes explain Mr. Floyd's death?
Yes, I did.
Would you tell us your opinion?
Sure. After reviewing all of the facts and evidence of the case, I can state with a high degree of medical certainty that George Floyd did not die from a primary cardiac event, and he did not die from a drug overdose.
Thank you, Dr. Rich. Would you tell us what evidence or facts, documents, what did you look at to help you to reach that conclusion about primary heart event and or drug overdose?
Sure. The three aspects of the evidence that I spent the most time reviewing were Mr. George Floyd's medical records, the videos, the different angles from the day that he died on May 25th, 2020, and the autopsy report.
So the medical records, the videos, and then the autopsy report.
Yes.
Let's start with the medical records then of those three. Would you tell the jury what you were looking for in the medical records?
Sure. So you get the medical records. It's usually pretty thick, but you take it one page at a time. And at the outset, I was looking to see if he had been diagnosed with any medical conditions. That's sort of the first step. Kind of it's what you do with a patient in the office, sort of what medical problems do you have? And so I was looking to see initially what diagnoses George Floyd may have previously been diagnosed with.
And what were your takeaways then from having looked at the medical records and done this assessment?
So at that level, I felt pretty confident that Mr. Floyd had three medical problems. Number one, he had hypertension, high blood pressure. Number two, it appeared to me that he may have suffered from anxiety. And three, it looked like he also struggled with substance abuse.
Other than those three conditions, did Mr. Floyd have any diagnosis of heart disease while he was still alive?
No, he did not.
So you said you looked at the medical records not only for diagnoses of pre-existing conditions, but also for evidence of medical encounters?
Correct.
And by that you mean hospital visits, clinics, etc.?
Emergency room visits, exactly.
What did you find in that regard?
So this is, in my opinion, was a really important part of the review as well, because every time Mr. Floyd had an encounter with a medical professional, I viewed that as an opportunity to see if there was any signs, symptoms whatsoever, even subtle, that could have indicated, for example, that he had anything going on with his heart. And so at the emergency room visits, he had one prolonged hospitalization. I really tried to take a look at everything. I looked at any opportunity I could to see if he ever complained of chest pain, which he did not, palpitations, which is a fluttering sensation of the heart. I reviewed all of the documented physical examinations of his heart to see if there were any abnormalities noted, and there were not. No murmurs, nothing found. I looked at all of his labs that get sent to see if there were any cardiac markers of injury, which he did not have. I reviewed his EKGs and his other tests. I tried to be as thorough as possible because I view what we do as a clinician in some ways as actually being a bit of a detective. And our job is to try to figure out what might be going on, even if it's not overtly stated so in the chart.
Would you tell the jury, by the way, what an EKG is?
Sure, of course. So an EKG is shorthand for an electrocardiogram. That's the test where you'll see people put these little sticky things on the chest. We call them electrodes. And what an EKG basically is an opportunity at the surface level of the chest, but the technology is so fascinating. It can give you a glimpse into the heart itself to see a whole host of things, including, is there any evidence of any heart injury happening now or previously? Any abnormal heart rhythms? a whole host of other information that we can get from the EKG at that snapshot in time. And then sometimes what we'll do is we'll repeat EKGs down the line so we can compare and contrast and see if anything had changed.
So you looked at all of this medical information on Mr. Floyd, including the EKG. Did you note any cardiac problems that related to Mr. Floyd?
I noted no cardiac problems in the medical records as far as Mr. Floyd's medical condition was concerned, including everything I mentioned, the EKG, even a time where they put him on a continuous cardiac telemetry monitor, which they'll do sometimes just to see beat to beat if anything's going on. I reviewed that as well.
Did you see any evidence of Mr. Floyd having had any abnormal heart rhythms?
His EKG showed absolutely no abnormal heart rhythms. That cardiac telemetry that I mentioned that he had on for a few days did have, on a rare occasion, something you would call a PVC, which is a very normal finding. I don't know if anyone's ever felt their carotid flutter for a second or something like that. It happens to all of us. But absolutely no ventricular arrhythmias for the duration of the time that he was on the monitor.
And PVC is not a kind of plastic pipe. You mean pre-ventricular contraction?
Yeah, premature ventricular contraction. Sometimes people refer to it as a skipped beat. A really normal phenomenon. If you drink a little coffee or anything else, you're sleep deprived. It's pretty common for us to have those totally normal findings, something that none of you should be concerned about if you feel that from time to time.
So did you find any evidence that Mr. Floyd had any negative heart conditions?
There was absolutely no evidence to suggest that at all.
Dr. Rich, isn't high blood pressure an abnormal heart condition?
So thank you for that question, because I think that's an area of confusion sometimes. So high blood pressure in and of itself is not a heart condition. High blood pressure occurs for basically two reasons. Number one, high blood pressure originates in the blood vessels of our bodies. Oftentimes it's genetically determined why our blood pressure might start to go up over time. If you have a strong heart, you can also generate high blood pressures, and so those two in combination. So why? Well, so I'll pause there and can explain more.
Well, did Mr. Floyd have a strong heart?
So every indicator is that Mr. Floyd had actually an exceptionally strong heart, because he was able to generate pressures of upwards of 200 millimeters of mercury on some occasions. We talked a little earlier about my role as a heart transplant cardiologist. One of the problems with patients when they need a heart transplant is the exact opposite. Their hearts are so weak they can't generate a high blood pressure. Their top number might just be 80. The reason why high blood pressure, though, is important, and it is important to treat high blood pressure, is because over time, if high blood pressure goes untreated, 10, 20, 30 years, the impact of that high pressure on the heart can eventually start to become a bit of a problem. So the way I explain it to my patients who come into the office and I talk to them about treating their high blood pressure is I say, remember, the heart is a muscle. So if you go to the gym and you pick up a couple of dumbbells and you start to lift the weights, initially it feels fine. In fact, you probably get a little stronger. Your muscle will likely get even a little thicker, a little bigger, which is exactly what it's supposed to do. And initially, that might actually be a really good thing. But if I came back, 10 years later and said, how's it going? You'd say, man, this is getting pretty tough. And then the muscle can start to tire out. So we do want to treat high blood pressure. I can't emphasize that enough. High blood pressure should be treated, but high blood pressure in and of itself is not a heart condition.
So we've talked about your review of the medical records. You told us that you also looked at video footage in forming your opinions. Would you tell us what you were looking for in the video footage that you examined?
Sure. So my approach to the video initially was sort of similar to my approach of the medical records, meaning I wanted to just do some cursory inspection, observation, basic stuff. what did Mr. Floyd look like? Was Mr. Floyd talking? And if he was talking, was he talking clearly, coherently, answering questions appropriately? Did I notice any evidence of abnormal physical exams on the video? Actually, I was trying to look for as well. When Mr. Floyd was walking, did he appear like he was walking without difficulty, or was it looking like he was perhaps with low blood pressure and maybe gonna fall down? I was listening for any opportunity I could to hear. He might say, I'm having chest pain, or I'm having those palpitations or fluttering sensations. Basically doing what I do when I assess any person for a possible medical problem. I was looking for any and all of those possible subtle signs.
And so this is video footage from Mr. Floyd's encounter on May 25th of last year.
May 25th, that's correct.
We're focused on things that would give you any insights into his ability to breathe.
Yes, of course.
And the ability to expand what's referred to as his chest wall.
Yes.
Again, to refresh the recollection of the jury, what is the chest wall?
Yeah, so the chest wall, which I'm trying to sort of show you with my hands here, basically makes up the bones and the muscles of the entire rib cage. And it might have been explained previously to you, but the chest wall and the muscles and how they interact, along with the diaphragm muscle inside, are the key structures that determine if someone is able to take in enough air and able to get enough out. So if there is, for example, the lungs can be working okay, but if the chest wall is diseased, if the muscles associated with the chest wall aren't able to contract and move and do their job, enough oxygen can't get in that way either.
So doctor, in our COVID world, do you make clinical assessments of your patients in your work life by video?
Yes, actually, that is one of the transformations that we have needed to adapt to this past year. We are getting back to now seeing most of our patients in person, but during the course of this pandemic, to minimize exposures, we've set up a lot of these tele-video visits with patients. And what I came to appreciate is that while there's no substitute to actually putting your hands on a patient, that's still preferable in my opinion, to really examine them closely, you can get a lot of information off of a video assessment, even physical examination, by looking at, I have them turn their neck to the side and I can see their neck veins, which is an indicator of pressures. I can see their legs to look if there's any indication of swelling, which might be congestive heart failure. Of course, I could just see the patient. I can see how they're breathing. I can hear how they're talking, if they seem breathless or short of breath. So we actually have found out that we can do a lot via video assessments.
Were you able to then see Mr. Floyd at the period of time after he was first approached by the police on May 25th, 2020?
Yes.
What were your observations about Mr. Floyd from that initial encounter with the police?
So from his initial encounter, remembering particularly when he was asked to get out of his car, he appeared fearful, but was speaking, I thought, clearly, answering questions appropriately. Didn't see any acute, what we would call acute distress. I saw no indicators at that time that he was suffering from low oxygen, for example, or from any active medical problem. And as I said, I was really trying to keep a close eye on some of the subtleties of his appearance and speech and so forth.
Were you able to observe at the point that he was being asked to get into the squad car?
Yes, I was.
What were your observations with respect to that period of time?
Yeah, so I watched him walk to the squad car, and then I was observing an interaction where they were asking him to get into the back seat of the car. I heard him talking about how he was claustrophobic. There were times when he was being, I'm not sure if it was pushed into the car or how it was, and it had even made indicators at that time that he couldn't breathe. But all of my observations at that point were still that up until the point that he was kind of getting pushed or pulled through the car and ultimately onto the pavement. Up until that point, I also saw no evidence that there was anything active going on from a cardiac standpoint, and that was really important for me to conclude.
And what sort of active thing might you have been looking for related to the heart over that period of time?
Yeah, so for example, let's say that he was having an arrhythmia, an abnormal heart rhythm, especially if it was originating from the heart. Oftentimes what will happen is you'll have the heart rhythm that goes abnormal, and you'll go from being like totally fine, like hopefully we all are here today, to instantly dizzy or even passing out. I didn't see any indicators that was happening. I didn't hear him complaining of dizziness or, again, fluttering of the chest. I couldn't see any swelling in his body. Again, I didn't want to take anything for granted that even from the initial encounter up until that point, what if something developed from point A to point B? And so again, up until that point, I saw no indicators of low blood pressure or anything else abnormal with the heart.
Then turning then to the restraint on the ground that you were referring to, what were your observations then as a cardiologist from your having viewed Mr. Floyd's restraint on the ground by Mr. Chauvin?
Sure. So my observations were that he was restrained in a life-threatening manner. Specifically, my observations was that he was on the ground in the prone position, handcuffed, hands behind the back, a knee on the back of his neck, a knee on the back of his upper torso or shoulder, hands pushing his handcuffed hands further up into his chest. I observed a knee compressing his, I thought it was his buttocks or upper thighs, and then at various points his lower limbs, his lower extremities being pinned down to the ground. So that my initial observation was, what is the position, first and foremost, that he is being subjected to?
And did you see at some point in you watching the video that Mr. Floyd went into cardiopulmonary arrest?
Eventually, yes, I did.
Do you know what Mr. Floyd's heart rhythm was when he was taken from the scene?
Well, so in the course of the restraint, I was looking to see if his deterioration occurred rapidly, like I was just talking about. For example, a primary cardiac event, the most common arrhythmia is what we call ventricular fibrillation, or VF for short, VFib. When that happens, the individual will look relatively okay, meaning they're alert, they're talking, and then they will immediately become unconscious. On the other hand, if the cause of the cardiopulmonary arrest was from something else, for example, low oxygen levels, you will typically see that deterioration happening much more gradually and slowly. So my observations were the second, that you could see, at least I could see, his speech starting to become less forceful, his muscle movements becoming weaker, until, of course, eventually his speech became absent, eventually his muscle movements were absent, and then as we later discovered by the heart rhythm, he was in a PEA, cardiopulmonary arrest.
So I'd like to talk with you about two concepts, the one being PEA, which is pulseless electrical activity, and the other one being a thing called a systole.
Mm-hmm.
Right. So first, Dr. Rich, would you tell us what pulseless electrical activity is?
Sure. So pulseless electrical activity, or for short PEA, is a chaotic heart rhythm that you can see on the EKG or on the cardiac monitor, but there is an absence of a pulse. And so it doesn't meet criteria for this asystole that I think we'll talk about in a minute, or for ventricular fibrillation. Ventricular fibrillation, if I'll just use my fingers, is basically the heart rhythm looking like this. Okay, it's this little subtle fluttering, but basically nothing else going on. Pulseless electrical activity, if you are a clinician, a doctor, or a nurse, or anyone for that matter, who's ever been trained in cardiac arrest, one of the things that will come to mind immediately is whenever you see a PEA arrest, you need to think about what's causing it, because nearly all PEA arrests are being caused by something relatively specific, and if you can identify what that is, it can be reversed.
And what is the most common cause of PEA?
So you might have heard of others talking about the H's and the T's. So one of those H's, the most common cause for a PEA, cardiopulmonary arrest, is hypoxia, not enough oxygen levels.
Low oxygen?
Low oxygen.
And what about asystole?
So asystole is the flat line. So, when any human dies, they will eventually go into asystole, where there will be absolutely no heart rhythm occurring, even this chaotic rhythm. That is what we, again, sometimes call that flat line. So VFib is this kind of thing. PEA can have a variety of chaotic looking rhythms without a pulse, and asystole is the absolute absence of any cardiac electrical activity.
If Mr. Floyd is in a PEA state, or generally anyone, is PEA reversible?
So it is important to put it into context. So we see PEA cardiac arrests in the hospital all the time. Whenever you see a PEA cardiac arrest, you rush to it, of course, and you begin the protocol. And that protocol is the H's and the T's. And so you give oxygen if you don't think they have enough oxygen. I mean, that's the most critical thing to do. Depending on the other H's, for example, hypovolemia or hemorrhage. If you think they're bleeding out from a trauma, you would rush and give them blood. And we're doing these things, of course, simultaneously because time is of the essence. So we resuscitate patients with cardiopulmonary arrest from PEA not infrequently. Unfortunately, PEA can also be a devastating cardiac arrest, and despite all of our best abilities, sometimes it's not reversible.
Dr. Rich, did you see any evidence at all that George Floyd had a heart about this notion of something called a silent heart attack?
A silent heart attack. Well, so a silent heart attack, a silent heart attack is sometimes referred if it looks like someone might have had a heart attack, signs to suggest it. It's a relatively uncommon finding. It tends to happen in patients who have diabetes, because when you have diabetes, one of the problems with diabetes is you lose some sensation in the nerve endings. And so typically when you're having a heart attack, you'll see people clutch their chest. Oh my God, I'm having chest pressure, chest pain. Sometimes diabetics won't have that, and it's possible that they can have a silent heart attack. But there was no evidence that Mr. Floyd had any type of heart attack, a silent heart attack or a non-silent heart attack.
And so you talked about this a little bit, about the notion of a cardiac arrhythmia, the fluttering of the heart. I think you referred to as either the VFs or the VTs, ventricular fibrillation or ventricular tachycardia.
Right.
Was there any evidence that he'd had either one of those?
He had any of those.
When somebody is suffering from ventricular fibrillation or tachycardia, Did you describe that as what we might refer to as a sudden death event?
Yes, so ventricular fibrillation, cardiac death, that absolutely could be described as that.
And again, in viewing Mr. Floyd and his encounter, did Mr. Floyd die a sudden death?
Mr. Floyd died a gradual death. It would not be considered the classic sudden death from the standpoint of how you're putting into that context, meaning when people have that ventricular fibrillation, that VF arrest, they literally go from being fine one moment to completely out the next. You know, I don't know what happened. I was sitting next to him and he keeled over and was on the ground. And then that could have been a VF arrest. So sometimes there's semantics in terms of this, but in the case of Mr. Floyd, yes, he did have a cardiopulmonary arrest, but no, he did not. There was no evidence of a sudden cardiac death from VFib or any other malignant heart arrhythmia.
Okay, so we've talked about your review of the medical records, and we've talked about your review of the video. The autopsy report and findings.
Yes.
What were you looking for with respect to the autopsy report and findings?
Sure. So, records that we've already talked about. Autopsy again. So what I was looking for in the autopsy was, well, first of all, everything. When we get an autopsy, oftentimes you'll get it because you're looking, could there be something that we weren't aware of that could have happened? But in addition to looking at all the findings, my major focus, of course, as a cardiologist, was anything and everything related to the heart.
What did you find?
You know, it's interesting. I think what was most important was not only what I found, but what I did not find. Yes, I have excluded that with a high degree of medical certainty.
Now, you talked about looking at the autopsy report and that you would expect it to have seen those if he had died from a heart attack, and you didn't see them.
Right.
What else did you see?
Well, so what I also saw was I looked at the heart muscle itself. So not only did the heart muscle itself not show any evidence of any injury at all, which you would see, like what if you mentioned the silent heart attack. What about a few years ago somehow he had a mini heart attack? You would see evidence of that in the heart. You would see scar tissue, etc. So not only did I not see any evidence of the pathologist did a very good job, in my opinion, actually, of describing what's called the endocardium. The endocardium is the innermost lining of the heart, and that is the most susceptible part of injury. Even the smallest of heart attacks will always originate on that endocardium, the inner lining. And the endocardium was not only described as normal, it was described as smooth and glistening, a completely normal finding, no evidence at all of even small microscopic injury.
Were you able, by your looking at the autopsy report on the heart, to tell whether there's any evidence as to whether Mr. Floyd had ever had a heart attack, even going back into the past?
Yeah, no evidence whatsoever of a previous heart attack.
Doctor, what is ischemia?
So ischemia is a blood flow to any organ of the body. That could be the heart, it could be the kidney, that can lead to basically insufficient delivery of oxygen for a short period of time. And if ischemia continues to occur for long enough, that can sometimes cause some irritability in that organ. But it's important to distinguish ischemia from infarct. Infarct is actually what we mean when we say a heart attack. A heart attack. When a marathon runner goes on a run, their muscles will get temporarily ischemic. When we lift muscles in the gym, and they talk about feeling the burn, that means you are feeling ischemia. You're feeling lactic acid buildup, and that's what ischemia is. Not on the autopsy, no.
Let's talk about the blood vessels, the arteries, and the plaque that was in the arteries. Were you able then to eliminate the occlusions, the blockage in the arteries as a contributing cause to Mr. Floyd's death?
Yes, I'd like to clarify. I saw no occlusions, meaning I saw no complete blockages. There were narrowings. There were vessel. Importantly, the main coronary artery, it's called the left main coronary artery, there was no description of any narrowings or disease in the left main coronary artery.
Why is that significant?
Well, because that is the very first pathway that blood travels down to then branch off into multiple other arteries. And so left main disease, as we sometimes call it in cardiology, is among all of the vessels probably the highest risk blood vessel if it were to get blocked off.
So how would you characterize the nature of the then plaque within the artery? Was it soft? Was it fractured? How would you characterize it?
I would characterize it the way that the medical examiner characterized it. I'm not an expert at characterizing plaque at a microscopic detail, but what I did appreciate was the description of what seemed to be not only relatively conventional looking artery narrowings, plaque buildup that we all will eventually get in our arteries, but also in one of the arteries it was described that there was an element of calcium. And I only mention that because that also indicates that this coronary artery disease didn't just kind of develop right away. It was probably a slow, gradual buildup of the narrowings, and that actually is a very clinically relevant finding in the field of cardiology.
Doctor, did you make any assessments around the size of Mr. Floyd's heart?
Yes, I did.
Would you tell the jury about that?
Sure. So when looking at the size of his heart, not just the size, but the thickness of the heart, it was described as being mildly thick or mildly enlarged. Now, depending on which criteria you use, one criteria would agree with that it was mildly thick or enlarged. Others would suggest that it was in the normal range. I do believe that it was likely mildly thick and mildly enlarged. It is an expected finding in somebody that has high blood pressure. So even though there are some scoring systems that might say it wasn't even enlarged at all, in my view as a cardiologist, I do believe there was just the smallest element of increased heart thickness. And as I mentioned before, that's important because that's exactly what the heart is supposed to do when there's high blood pressure. That is a normal response. The muscle's getting stronger, it's allowing the heart to work and work well. Now, if that goes on for, like I said before, 20 years, we can have problems, but early on, having a mildly thickened heart is not only a normal finding in someone with high blood pressure, it may actually be beneficial in the short term.
Doctor, putting all this together, did you see any evidence at all that the primary cause of Mr. Floyd's death originated in his heart?
No, I did not.
Let's talk about a new subject. Whether or not Mr. Floyd suffered from a drug overdose and died from a drug overdose.
Okay.
That was something that you also considered as a cause.
Yes, sir.
Were you or are you familiar with Mr. Floyd's toxicology results?
Yes, I am.
What or which substances did you consider in evaluating Mr. Floyd's toxicology history?
When I looked at the toxicology reports, I focused mostly on the finding of fentanyl as well as the finding of methamphetamines.
What role, if any, do you feel that the fentanyl played in the cause of Mr. Floyd's death?
As far as I can tell from reviewing all of the facts of the case, I see no evidence at all to suggest caused Mr. Floyd's death.
Do you occasionally have to care for patients who struggle with opioids or opioid addiction?
Absolutely.
So here you found that the fentanyl, in your opinion, played no role in Mr. Floyd's death. Would you tell us why it is you hold that opinion? How do you reach that conclusion?
Well, I think I would break it down to just two major reasonings. Number one, it appeared to me that Mr. Floyd, who was an acknowledged frequent chronic user of substances, particularly opiates, likely developed a high degree of tolerance. There's even one emergency room visit that I had reviewed where he came in and he told the emergency room team that he was tearful and says, "I'm having trouble with substance abuse. I think he said I took 8 Percocets within 2 hours. He had no side effects from that at all. They observed him for a couple hours and they discharged him." And just so looking through it, looked like he had built up a high tolerance just in general to opiates. But the second, and just as important, maybe more important, was I didn't see any of the signs of an opiate overdose when I reviewed the videos.
And when you then are referring to the signs of an opiate overdose, would you tell the jurors or describe for them what are those signs and what didn't you see?
Sure. So in my experience in the intensive care unit, taking care of patients who come in with an opiate overdose, first of all, they are usually extremely lethargic, oftentimes nearly unarousable. And then you try to wake them up and they're falling right back asleep. They're not talking to you. If they are talking to you, they're often having slurred speech. If they're standing up, which they wouldn't be if they had a fentanyl intoxication and overdose, they would have to imagine get pretty dizzy pretty quickly. I kind of saw all the opposite with Mr. Floyd. I saw that he was alert, he was awake, he was conversant, he was walking, and yet, according to the toxicology report, he had this degree of fentanyl in his system. So just looking at the clinical story, I didn't see any signs or symptoms of fentanyl overdose.
Let's turn to methamphetamine then. What role do you feel that methamphetamine played in Mr. Floyd's cause of death?
I feel it played no substantive role at all.
And why is that?
Well, all considering, it was a very relatively low level of methamphetamine in his system. And so when you look at the context of the case and you see a relatively low level of methamphetamine in the context of everything else, I felt very confident that that low degree of methamphetamine was not what was triggering this profound cardiopulmonary arrest and ultimately PEA arrest.
So Dr. Ritz, then, taking into account all of the evidence that you reviewed, do you have an opinion to a reasonable degree of medical certainty as to whether Mr. Floyd's death was preventable?
Yes, I do.
Would you tell us what that opinion is?
Yes, I believe that Mr. George Floyd's death was absolutely preventable.
Were there critical points in time during his subdual and restraint on the ground when you feel measures could have or should have been taken that would have preserved his life?
Yes, I do. I think there were several junctures, actually.
Would you tell us about those?
Sure. Well, the first, of course, was to not subject him to that initial prone restraint positioning that he was subjected to. I mean, that is first and foremost. So if that was not the case, I don't think he would have died. The second, though, was when he was in that subdual and restraint positioning, and he was stating repeatedly that he can't breathe, and he was getting a little weaker in his speech. There was one moment in the video where I heard one of the officers saying, I think he's passing out. That would have been an opportunity to quickly relieve him from that position of not getting enough oxygen, perhaps turn him into a recovery position and allow him to start to expand his lungs again and bring in oxygen and get rid of carbon dioxide. So in addition to not putting him in that position in the first place, when there were signs that he was worsening, repositioning him, I think very likely would have also saved his life.
Was there a point in time, Dr. Rich, when Mr. Floyd was checked for a pulse when he was in the subdual and the restraint of Mr. Chauvin?
Yes, there was.
At the time that he was checked for a pulse and he no longer had one, in your opinion as a cardiologist, was there anything Mr. Chauvin could have done at that point in time that would likely have saved Mr. Floyd's life? Well, at the time that Mr. Floyd is determined to have not had a pulse, what is your opinion, to a reasonable degree of medical certainty, as to what Mr. Chauvin may have done that would have potentially saved his life?
Overruled. You can give an opinion.
Well, just prior to that point, I heard one of the officers actually ask, actually on 2 occasions, if Mr. Floyd should be turned on to his side. And the response was, no, just leave him. And once the officer announced that he did not have a pulse anymore, I think he actually said he does not have one, was the exact words. At that point, the immediate response would then be to not only relieve him of the restraint, but at that point now you've got to start CPR. You've got to start immediate chest compressions, because we know that if you can get to a patient right away, even when they've lost their pulse, even when they've gone into a cardiopulmonary arrest, there is a significant opportunity to save a life. But for every minute that transpires that you are not performing the basic life support and CPR measures, the literature would suggest an approximately 10 to 15% less chance of survival. It is why we pour so many resources these days into community education and training for bystander CPR, because it's so effective and it works if the person can be tended to quickly enough.
Then from your review of the video, where you could see Mr. Floyd and Mr. Chauvin there on the ground, if Mr. Chauvin knew CPR, did you see any reason from your observation that he could not have supplied CPR?
Not within the opinion, medical opinion, so that is sustained.
I'm sorry, Your Honor.
Sustained.
All right.
It's not a medical opinion, counsel.
So at the time then that Mr. Floyd was actually put into the ambulance from the scene, in your opinion as a cardiologist, what would have been the prospects of resuscitating him at that point?
Overruled. You may give an opinion if you have one.
So at that point, I think the chance of meaningful survival, unfortunately, was very low, because I counted the number of minutes that he was on the ground pulseless without any CPR. And by the time the paramedics rushed in to get him and to get him onto the stretcher and into the back of the ambulance, at that point, a lot of time had passed. I give tremendous credit to the efforts of the paramedics and the doctors and nurses in the emergency room. I mean, they worked on him for what seemed...
Sustained. This is non-responsive.
Dr. Rich, do you have an opinion to a reasonable degree of medical certainty as to whether Mr. Floyd would have lived if not for the 9 minutes and 29 seconds of subdual and restraint?
Objection.
Overruled if you have an opinion.
Let me finish my question for you, Dr. Rich. Do you have an opinion as to whether George Floyd would have lived if not for Mr. Chauvin's subdual and restraint of him for 9 minutes and 29 seconds on the ground?
Yeah.
Overruled.
I believe he would have lived.
Last question, Dr. Rich. Do you have an opinion as to whether a completely healthy George Floyd, that is, any healthy human being, would have survived the subdual and restraint that Mr. Floyd suffered during the 9 minutes and 29 seconds on May 25th of 2020?
Objection calls for speculation.
It's sustained as irrelevant as to a general person.
I'm sorry, I couldn't hear you.
Sustained.
My question for you, Dr. Rich, is would any person, a healthy person, have survived the circumstances or conditions that George Floyd underwent during the 9 minutes and 29 seconds on May 25th of last year?
Same objection.
Sustained.
No further questions, Dr. Rich.
Thank you.
Members of the jury, let's take our 20-minute mid-morning recess. Let's come back at 11:25. Thank you.